Did you know that nearly 1 in 3 adults worldwide suffers from high blood pressure, and most don't even realize it? Hypertension is often called the silent killer because it usually has no symptoms but can quietly damage your heart, kidneys, and brain. The good news is you don't always need heavy medication to keep it under control. With the right doctor-approved lifestyle changes, you can naturally lower your blood pressure and protect your long-term health. What is high blood pressure? Hypertension, blood pressure, is the force of blood pushing against artery walls. It's measured as 2 numbers in a reading. The top number, called systolic pressure, represents the pressure when your heart beats and pumps out blood. The bottom number, or diastolic pressure, measures the pressure when your heart is at rest between beats. A normal blood pressure reading is considered to be 120/80 millimeters of mercury, mmHg, or below. When your blood pressure consistently goes above 130/80 mmHg, you're diagnosed with hypertension. That's because those numbers indicate that your heart is working harder than usual to pump blood through your body. Over time, this added strain can cause serious health problems like heart disease, stroke, kidney disease, and vision issues. But the scariest part is that many people with hypertension don't know they're at risk. That's why it's essential to check your blood pressure regularly, especially if you have risk factors like a family history of hypertension, diabetes, obesity, or high cholesterol. Fortunately, there are plenty of proactive steps you can take to protect yourself from the dangers of hypertension. By understanding your risk factors and adopting healthy habits, you can keep your blood pressure in check and reduce the risk of complications. Let's dive into some doctor-approved natural tips to help you manage your blood pressure effectively. Number 1. Adopt the DASH diet. The DASH diet isn't just a passing fad. It's a scientifically designed eating plan that has been clinically proven to lower blood pressure within weeks. Developed by the National Heart, Lung, and Blood Institute, DASH stands for Dietary Approaches to Stop Hypertension. At its core, the DASH diet emphasizes fresh fruits and vegetables. These should make up half of your plate at each meal, providing essential vitamins, minerals, and fiber. Whole grains. Choose whole grain bread, pasta, and cereals instead of refined versions. They contain more fiber, which helps lower blood pressure. Lean protein sources include fish, beans, nuts, and low-fat dairy products. These provide protein without the excess saturated fat found in red meat, limiting saturated and trans fats, cholesterol, and added sugars. Processed foods, red meat, and sugary drinks are a big no-no. Instead, focus on fresh, whole foods. When you stick to the DASH diet's recommendations, you'll naturally cut down on sodium while increasing potassium, magnesium, and calcium intake. These changes can lead to a significant reduction in blood pressure, often comparable to taking medication. And the best part, you won't have to endure the potential side effects that come with some blood pressure drugs. If you're already on medication, talk to your doctor about adjusting your dosage after seeing how well the DASH diet works for you. For most people, the DASH diet isn't a temporary fix. It's a lifestyle change that can prevent hypertension and other chronic diseases. Remember, consistency is key. Make gradual changes to your diet and stick with them long term. Number 2, reduce sodium intake. One of the quickest and most effective ways to lower blood pressure is by cutting back on sodium, especially if you're already dealing with hypertension. Most adults should aim for less than 1,500 milligram of sodium per day. However, it's crucial to read food labels carefully as many packaged and processed foods contain hidden sodium. On average, Americans consume about 3,400 milligrams of sodium per day, far exceeding recommended limits. Reducing your sodium intake can lower blood pressure within days or weeks, according to the American Heart Association. Here are some easy ways to cut down on sodium. Cook meals at home using fresh ingredients so you control the amount of salt added. Season your food with herbs, spices, lemon juice, or garlic for flavor instead of salt. Avoid adding extra salt at the table. Be cautious of restaurant foods as they often contain high levels of sodium. Ask for your food to be prepared without salt or soy sauce, which is high in sodium. When dining out, choose dishes that are grilled, baked, or brothy rather than fried, as frying adds sodium. Limit or avoid canned soups, frozen meals, and packaged snacks as they typically contain excessive sodium. Remember, reducing sodium intake isn't about completely eliminating salt from your diet. It's about being mindful of how much sodium you consume daily and choosing healthier sources of flavor. Start by cutting back gradually, and you'll soon notice a difference in your blood pressure levels. Number 3, stay physically active. Regular physical activity is essential for maintaining good health and well-being. When it comes to blood pressure, staying active is crucial for both prevention and management. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Here are some great options. Brisk walking, a simple yet effective way to strengthen your cardiovascular system. Cycling, low impact and excellent for improving heart health. Swimming, a full body workout that's gentle on joints. Yoga, helps manage stress and lower blood pressure through controlled breathing and poses. Strength training involves using resistance bands or weights to build muscle and improve overall fitness. In addition to these benefits, regular exercise can also help you maintain a healthy weight, improve insulin sensitivity, and enhance your mood. Just make sure to consult your doctor before starting any new exercise program, especially if you have pre-existing health conditions. Remember, even small increases in activity can make a difference. So find activities you enjoy and make them a part of your daily routine. Number 4, maintain a healthy weight. Carrying excess weight places added strain on your heart and blood vessels, leading to higher blood pressure. In fact, studies show that for every 22 pounds, 10 kilograms, you're overweight. Your risk of developing hypertension increases by 30. Losing even 5 to 10 pounds can significantly reduce blood pressure levels. And the best part, you don't need to resort to extreme diets or fads to achieve this. Some simple strategies include watching portion sizes, especially of calorie-dense foods. Focus on filling your plate with nutrient-rich, low-calorie options like fruits, vegetables, and whole grains. Staying hydrated. Drink plenty of water throughout the day as it can help curb appetite and prevent overeating. Cutting back on sugary drinks. Soft drinks, fruit juices, and energy drinks contribute empty calories and can lead to weight gain. Replacing processed foods with whole foods. Choose unprocessed or minimally processed foods like fresh produce, lean proteins, and whole grains over packaged snacks and fast food. Being physically active. Engage in regular exercise as it helps burn calories and reduce stress. Incorporate a combination of cardio, strength training, and flexibility exercises into your routine. Getting enough sleep. Aim for 7 to 8 hours of quality sleep each night. Poor sleep can disrupt hormone levels, leading to increased appetite and cravings. Managing stress effectively. Practice stress-reducing techniques such as deep breathing, meditation, or yoga. Chronic stress can elevate cortisol levels, potentially raising blood pressure. Remember, sustainable weight loss is a gradual process. Set realistic goals and celebrate your achievements along the way. By adopting a balanced approach to weight management, you can not only reduce blood pressure, but also improve your overall health and well-being, and that's all for today. Thank you so much for watching. Until next time, stay healthy, stay informed, and take control of your well-being.